Many parents worry when their child frequently gets coughs, colds, or fevers, but in most cases it's not serious. Some children are simply more sensitive to dust, smoke, perfumes, animal dander, or common viruses. These can irritate their airway, causing a lingering cough. If coughs or colds return after exposure to triggers, try to identify and avoid them. Sometimes allergy testing can also help. If the problem continues, consult your pediatrician to prevent repeated airway irritation. Also, check your child's growth. If they eat well, grow normally, and stay active, there's usually no major health issue. A healthy diet, good hydration, and daily sunlight build immunity. With proper care, most children outgrow frequent cough and cold episodes.